Okay, I just want to do a little explanation on what you're going to see on the thyroid and as to why. I've uploaded some other videos to your lecture portion, but I wanted to go through and explain. So the thyroid is an organ, an endocrine organ. It sits center line just at the lower base portion of the neck. Now we scan it like we do with most organs in two orthogonal planes. So we start off in our longitudinal plane, and then we have our transverse plane. So this explains the different cuts and what you're likely to see. So we'll start with the sagittal side. If we go through, we sweep lateral. We know lateral is in regards to the organ, and in this particular situation, it's also in regards to the body. So usually what I like to do, we know that the surrounding anatomy includes the common carotid artery, and then the inferior jugular vein. So if we go through and we sweep out laterally, lateral to the thyroid, we will see the first vessel we'll see is going to be the carotid. So that's a very good landmark. It's very consistent. It doesn't go anywhere. So once we start sweeping from the carotid more medially, you're going to come into the lateral portion of the thyroid. So again, if we imagine like right here is where the common carotid would be laying in regards to the thyroid. So lateral, and then we sweep in medial, and you can see our first little dotted line cut, which is going to be our lateral section, which you'll see up here. It'll be a nice little sliver slice shaving of the thyroid gland in sagittal plane. So we're always scanning from anterior to posterior with the thyroid. So what would the question marks be? Where would our notch be? Give you a second to think about it. So since we're in that sagittal plane, it's going to be the superior and inferior portion of the thyroid. And again, it's got a little sliver shape to it, whereas if you start to move towards the midsection, you're going to have a bigger chunk. Here I have the different muscles that sit anterior to it just to kind of demonstrate what the muscles will look like. And then it's a very similar shaped piece. However, the mid portion is going to be a lot thicker, and it's going to be a lot longer. Sometimes you do have a portion with getting both the superior and inferior portion on your screen. With that, then we would switch to the curvilinear probe to just get an accurate measurement. So again, when we're out lateral, we just get a nice little thin strip of thyroid. And then when we get to the mid portion, it's going to be a lot thicker. And the reason that is so we can go through and do our accurate measurements. So we would measure from superior to inferior and then anterior to posterior. And again, a lot of times you'll have to switch to the curvilinear probe to get the entire portion. Now, when we move medial, the shape starts to look to me like a little bit of a sailboat. We start losing our meat of that thyroid gland when we start sweeping towards the isthmus portion right before we get to the isthmus. So you'll have a very similar appearance to what looks to me like a little bit of a sailboat for the medial aspect. So again, we're all the way lateral. If we go lateral to the thyroid, we're going to see the common carotid artery. Then as we start sweeping medially, the first thing we're going to see is a little thin teardrop-ish muscular, reminds me of like a muscle shape, how the muscles are shaped laterally. Then we would see a mid portion where it's going to extend from one portion of the screen to the other. And again, that's in a typical normal thyroid. If you have somebody who's got an underdeveloped thyroid, it may be a little smaller. And again, a lot of times in this mid aspect, we'll have to go through and change to the curvilinear probe in order to get an accurate measurement. And then when we keep moving medially, we get this nice little portion here where we start losing a little bit of our thyroid material, and it looks again like a little bit of a ship. Now, if we move over to the God bless you. If we move over to the transverse portions, we'll start with superior. So superior, all you're going to really see is thyroid tissue. I say that because when you start moving down, you'll get a little bit of the isthmus in. So what you'll see in a transverse plane is, again, lateral to the thyroid, you'll see the common carotid artery and then the jugular vein. Now, you're not going to see those in sagittal, and again, that's because we're in a long view, so you would have to actually sweep out laterally from the thyroid to see the common carotid or the jugular vein. But in transverse, you don't need to do that. We'll have those landmarks in the picture. So again, what you're going to see is just like a little ball. To me, it looks a little bit like a square with rounded corners. But again, everyone's is a little bit different. But again, it's just going to be like a little round ball type shape at the superior aspect. Now, when you start moving down to the mid aspect, the mid is usually that widest portion where we start getting a little bit of the isthmus coming in. You'll either see like where it comes off to a point, or you'll have like a little very thin piece of that isthmus tissue. And and the isthmus tissue is the portion that connects the right and the left lobe. And again, you're still going to see that common carotid and jugular, but what you're looking for with the mid is you want to again be in that nice transverse plane, and you want to get the widest portion of this thyroid. And again, we do measurements on the mid portions, the widest portions. A lot of times it's for follow-up or to make sure that they're within that normal size limit. So again, go through it in a transverse plane. Now, if we're in a transverse plane, let's identify what is the question marks. What are they gonna go through? What would they represent in this situation? I'll give you a second to think about it. So either medial and lateral, I guess this would be assuming that you're on the left. So what I would say is this is towards the right-hand side and then towards the left-hand side. And again, that's the right-hand side and left-hand side of that patient. So it depends. In this particular scenario, it's lateral to medial, but if we were on the right-hand side, it's just right to left would be the easiest. Because again, our image would be, if we were on the right-hand side, it would essentially be this image, but completely flipped, because again, we're on the left, demonstrating the left, the right would be the exact opposite. So again, that question mark is gonna be either right to left, no matter what, or depending on what side you're on. Again, we're on the left-hand side, so it's medial to lateral. If we're on the right-hand side, it would be lateral to medial. And then we move down towards the inferior portion of the thyroid, and you can see here that there's a little bit more isthmus in the picture. When we start getting inferiorly, that's where that isthmus connects. So typically when we're in the inferior pole of the thyroid, you're gonna see a little bit more of a cut of it. You're gonna see a bigger piece, whereas the mid portion, you shouldn't really have that thick isthmus. Usually if you have a thicker isthmus in your quote-unquote mid-cut, then you're probably a little too inferior. So again, you move down inferiorly and you'll have this nice thick cut of the isthmus, and usually the thyroid becomes a little shorter, a little more like a blunted, short fat little piece, versus here where it's a little bit longer, anterior to posteriorly, and a little bit thinner, more of a square here, where here it's very, very short and squatty. So again, superior pole, you're not going to see any isthmus. You will see the common carotid and IVJ in every single cut that you get. And again, that's just going to be in that transverse cut, and sagittal, you won't get that. And again, superiorly, it's just going to be short piece, no isthmus, usually rounded out or square with rounded corners. In the mid portion, it's going to be your widest portion. Again, you're still going to see a CCA and IJV. And again, widest portion here, you won't have some isthmus, but you won't have a lot of isthmus, but you may possibly see some starting to come in where it comes off to a point, or a little very thin strap of isthmus extending to the in this case, the left side of your screen. And then the inferior portion, you're gonna have a good chunk of isthmus with it. The actual thyroid itself will be shorter, it'll be squattier, and it won't be quite as wide. So again, goal is to get, we want to do obviously a good sweep through, but we want to make sure that we're in the proper areas when we're taking our diagnostic images. So that way when we can go back, especially with a lot of these, we do follow-ups, you'll go through and you'll have people try to follow it, and you want to make sure you're in that right area, so that way when someone is following you, or you're following someone else even, you know where to look for particular pathology. So again, when you're seeing a good chunk of that isthmus, you're probably in the inferior pole, whereas the mid pole, you just have a little point, and that gets very confusing, especially for new sonographers, so I like to reiterate that. But again, you're going to measure the transverse at its widest point, which is typically in the mid, and then on the sagittal at its longest point. You may have to go through and elongate your probe by doing what I call the little fishtail, where you go through and just kind of wiggle your probe back and forth until you get this nice elongated piece. But again, if we continue to sweep out, we'll see the common carotid artery and then the IJV laterally to the thyroid. There are also some other videos on some things that you're going to see. Two big things I really like to address is the trachea, which again, if we were to imagine that this was an egg, would lie just posterior to the isthmus. Sometimes people include the anterior trachea portion with their posterior isthmus measurements. So just something to keep in mind when you're imaging, to make sure that you get a really good definition between the trachea and the isthmus, the posterior portion of the isthmus and the anterior part of the trachea. Really make sure you get those separated so you're not including the trachea in your isthmus measurement. Another big thing that I have seen is posterior to the left lobe of the thyroid. Take a minute and think about what you see posterior to the left lobe of the thyroid. If we watch the other videos, this should come right to you. So posterior to the left lobe of the thyroid, you're going to see something that looks almost like a bullseye. That's your esophagus, or the patient's esophagus in this particular situation. people oftentimes mistake that if they don't know the normal anatomy for a mass. It's sometimes it's very prominent in some people, sometimes it's less prominent, but again, it's just going to lie posterior to that left lobe, just slightly off-centered. So you're going to see what, essentially is going to be the throat / trachea, and then to the left-hand side, in a transverse scanning plane, you will see posterior to that left lobe, you will see the trachea, or the esophagus as well. So I hope this helps. If there are any other questions, feel free to let me know.